Time now for French Connections, our weekly look at the intricacies of French life with Florence Villeminot.
Hey, Rochelle.
Flo, good to have you. Now, many viewers have been curious about France's healthcare system, a system which has a reputation for essentially being high quality, for being widely accessible and also affordable.
And French people are very proud of their healthcare system that was crowned best healthcare system in the world by the World Health Organization in the year 2000. Now, this publicly funded system is similar to other systems in Europe, whether it's in Belgium or the UK or in Germany, but the French system, Assurance Maladie, is an object of international fascination, particularly in the US. During the whole Affordable Care Act debate, France came up time and time again as an example or a counterexample.
All right, well, the French healthcare system isn't just generous, it's also incredibly wide-ranging as well.
It's a mandatory system that's universal. That means it covers all legal residents. Any French resident over the age of 16 has one of these. This is my extreme close-up of my carte vitale. It's a health ID card that has come to symbolize healthcare in France. And, it can take some time to get one, but it's really easy to use once you do. You just show up at your point of care and you swipe it, and it contains all the details of your rights to medical treatment and refunds, which are very generous here in France. Let's take a look. The government refunds 70% of most healthcare costs and 100% of fees for serious or chronic illnesses like cancer or AIDS. Solidarity is a crucial part of the French healthcare insurance system. Essentially, the sicker a person is, the less money they pay.
I can vouch in saying that the carte vitale is very difficult to get hold of. I spent a lot of time, but once you have it...
Holy Grail.
It's the Holy Grail, it is indeed. The truth of the matter, though, Flo, is that the French healthcare system isn't as expensive as it is in other countries to begin with.
And that's because the government participates in setting what it considers fair prices for appointments, procedures, and drugs. And since the government covers the entire population, it has a lot of bargaining power to keep prices low. You can see it here. This is the cost of visiting a general practitioner here in France. That's been this price since the 1st of May 2017, 25 euros, and 70% of that will be reimbursed. Now, some doctors do charge more than 25 euros, for instance, specialists, gynecologists, heart doctors, etc., but you'll never see the dizzying prices that you see, for instance, in the United States.
Right, well, most French citizens also sign up for a complimentary private health insurance. That's to kind of top up their reimbursement to make it 100%.
About 90% of French people have private medical insurance. It's called a mutuelle here in France. They mostly get this mutuelle through their jobs, and it essentially covers things that isn't covered by the state. For instance, going to the dentist or getting new glasses, etc. And if you've spent any time in France, you've probably heard about the mutuelle because competition is quite tough between these different mutuelles, and so there are advertisements everywhere, at the cinema, anywhere, on TV, etc. And the jingles tend to be quite creative. Let's take a listen to some of them.
Maïf, assureur militant.
Efficace et pas cher. C'est la MAF que je préfère. C'est la MAF. Zéro tracas, zéro blabla.
MMA, those stay in your head all day long. Now, what's interesting is the reputation of French healthcare being 100% socialized is wrong. It's actually a hybrid system between public and private, and all this is very advantageous for patients. Just listen to this pharmacist.
Here we have a prescription for about 55 euros. National health insurance covers 34, private insurance covers 21. The patient doesn't pay a thing. Customers say the pharmacy is the only place they can leave with a full bag without spending a single euro.
Well, Flo, the question is, if people effectively don't have to pay for their health care, or at least they pay very little, who's paying for it?
Well, national health insurance is financed by taxation and participation from workers and employers. Essentially, everyone pays into the system, but they get a lot out of the system. The problem is that the system has been struggling to stay afloat in recent years for several reasons. Rising unemployment and an aging population means that less money is being pumped into the system, but France spends a lot on its on public health care, essentially. 11% of GDP. For instance, French doctors are known to prescribe a long list of medication, making France one of the highest consumers in prescription drugs.
I'm sometimes amazed when I receive a prescription of all this medication. I think I can't possibly need all of that stuff on the list. All right, but recent governments have put in place measures to cut spending. France is still facing a towering deficit.
The figures are quite extravagant. Let's take a look at the figures from 2016. The healthcare deficit came up to 4.8 billion euros. That's the lion's share of something known as the trou de la sécu, a very important concept here in France. It's our word du jour. The trou de la sécu is the massive deficit of France's wide-ranging social protection program called Sécurité sociale, translated as social security, but it's much more wide-ranging than the U.S. social security. It covers healthcare, but also pensions, generous family subsidies, etc. Now, critics say the system is hemorrhaging money. It has been getting smaller over the years, and it's a very tough system to reform because French people are very attached to it.
It's an extraordinary system, even if we take advantage of it a bit.
Well, some people do, but we're so lucky it exists. We're lucky to live in a country with Social Security.
Flo, that touches on a very important point. Though it costs the state a lot of money, French people are extremely attached to their healthcare system.
Particularly the philosophy behind it. Whether you're rich or you're poor, you won't drown in medical bills, you won't fall through the net, and you'll get good healthcare. France repeatedly scores amongst the highest in terms of quality healthcare, patient satisfaction, and a general population that's in good health if you look at life expectancy, etc. Now, the system is far from perfect, and time again there are calls to reform it and improve it, but many people have a happy healthcare story. And when they, receive their medical bills, they can heave a sigh of relief, which is pretty rare compared to other countries.
Absolutely. I can think of a few happy medical stories here in France. Thank you very much, Florence Vimino, for our French Connections segment. And don't forget, if you do want to see more of our French Connections programme, you can always log on to our website, france24.com.